Hi, Dr. Lori Stevens here, and I'd like to talk about root canals. I have a lot of questions about, are all root canals bad? Um, is there an alternative way to do them? How do I know if I need a root canal tooth out? So, yes, there is an alternative way to do them now called regenerative endodontic therapy. And that is where, especially in young kids, 6 to 15 years old, along in that age range. If they break a front tooth, then with a Photon laser, an endodontist who's a root canal specialist can take out the damaged part of the nerve and leave the rest of the nerve that is still vital or still alive, and take some blood from a blood draw and spin it down and get the growth factors out of the patient's own blood and put those growth factors in there to try to regrow the rest of that nerve. And so that would keep that tooth alive, and especially in a young person, then allow that tooth to remain in a vital state or alive state for hopefully the rest of that kid's life as that kid grows up. And he wouldn't have to have a root canal for years and years, and that tooth would hopefully just remain vital and remain just like the rest of the teeth. And most of that regenerative root canal therapy or endodontic therapy is done with specialists with a photona laser and using a microscope. So they look through the microscope so they can see in a great more detail. And the pioneer, I guess you'd say, of this is Val Cantor, and she's in Los Angeles, California. And I have had some patients from Georgia go there for that very kind of treatment. And then in her office, I've had some people who live locally go there also. But that is the cutting edge of endodontic or root canal therapy. And so it's mostly for young people who break a front tooth that would make a big difference in the way that that child grows up or that young adult grows up, and the way he looks with one front tooth fake and one front tooth not. So that's typically the ideal patient for that kind of thing. I don't know that it's done so much in like molar root canals in adults, that kind of thing. I don't know that it's so much that way. Val's the only person that I personally know of that does it, but I'm sure there are others. And as far as just regular root canals go, many of them are a source of low grade infection. And now there's a lot of hype and a lot of fear about root canals. Much of it, I think, is warranted. Most of the time, a root canal is a source of low grade infection for the patient long term. One thing you can do about that is ozone therapy. So if you're not familiar with ozone therapy, it's like the ozone, God's air cleaner. It's like the ozone layer of the atmosphere that the weather people talk about. Now, they make it kind of in a bad light, but actually, ozone is a 3,000 times better disinfectant than bleach. And you can drink ozonated water. We lubricate ozone, medical ozone now, not just industrial ozone. So, not your air cleaner machine. It's not that. Um, but a medical ozone delivery system lubricates with organic olive oil if you're going to breathe it. It's the ozone is too strong for the lungs unless it's lubricated. And then once that is lubricated with some olive oil, then you get some terpenes, which are uh, good things that go along with the ozone, and you get the effect of both. And it gets in your bloodstream through breathing it. And you just use a little nasal cannula, and we can deliver the ozone into your lungs, and it gets then through the alveoli and the capillaries, gets into your bloodstream. I also have a stethoscope hooked up so that the non-lubricated, just plain medical ozone can go into your ears, and it gets in your bloodstream through the tympanic membrane. So the ozone goes in your ears through a little stethoscope, and it goes right straight through the tympanic membrane into your bloodstream. So it'll circulate all over your body, delivered through your ears. That's great for TMJ. It's great for just boosting immune system. If, say, somebody needs some surgery and they're just too debilitated, that'll boost their immune system, get them ready for surgery so they heal better. All kinds of, say somebody's got really bad sinus infection and they can't wear their oral appliances because they can't breathe through their nose, and that'll help clean that up. So ozone has many, many uses in dentistry, but especially if a tooth is infected, if it's been treated with a root canal or not been treated, ozone can be injected around an infected tooth, which is, I explain it to my patients like it's like shocking a swimming pool. That won't last all summer. Keep your swimming pool clean all summer, but it'll make it look good for the weekend, for the party you're having this weekend. So if people say have a root canal and they really need that tooth, it's a strategic anchor for some prosthesis or something, and it's had a root canal, one way to keep that source of infection down is to do an ozone injection around the tooth 2 to 3 times a year. Typically will prevent that from being a source of low-grade infection that just challenges the immune system continually. So that's one thing that has come up in the last, for me, in the last 15 years. And ozone is getting more widely recognized in the medical community. It's been around a long time, 150 years or more, I think. And it's getting more widely recognized as a very safe, effective anti-infective agent. And so, particularly around root canals, infected teeth that have not been treated, and somebody's got a gum boil, that's a sign of an abscess happening. And for pain relief, really and truly, ozone is the best pain reliever because it disinfects the tooth so well. I started in dentistry in 1980. It's been a long time ago, and the best pain relief that I have found is ozone. And it can be if we're working on a tooth, taking out mercury amalgams, or just doing a filling, taking out decay. If we have to work on really anything, any therapy that we do in the mouth, ozone is a great disinfectant. Therefore, it is a great pain reliever. In my mind, in my experience, if a tooth is sensitive or tender, there's some amount of bacterial or fungal or viral infection in that tooth. And when the ozone, which is a 3,000 times better disinfectant than bleach, when it disinfects the tooth, the bone around the tooth, the periodontal ligament, the gums, then pain is virtually non-existent. I haven't had a drug license in 15 or 20 years, and I have done surgery through many of those. I don't do surgery now. I quit 6 or 8 years ago, but I didn't need pain medicine when I did surgery because the ozone is such a great disinfectant. Therefore, it is a great pain preventer and a great pain reliever if somebody's got an infected tooth. So if you've got a gum boil, your face is swollen, that's a sign that the tooth has abscessed. And it is, in my experience, I've never seen one reversed. I've never seen one healed. I believe in miracles, but I just haven't seen one in the case of an abscessed tooth. So if a tooth has had a gum boil or your face is swollen, that's an indication, that's an irreversible process. So there are two ways to treat that. And one is to do a root canal, which takes out the dead nerve, lymph, and blood vessels out of the inside of the tooth, and then is filled with a natural rubber substance called gutta percha. And that just replaces the living part of the tooth, and the tooth still stays there. And if that is the choice that you make, if the tooth is sturdy and the root is sturdy and there's not a fatal fracture or a decay that just undermines the structural integrity of the tooth and you keep the tooth, then I do recommend that you have ozone injected around the tooth just to clean up that bone because it is a dead area. So bacteria like scar tissue because there's no electrical activity in scar tissue. So they kind of use that as a dark corner to go hide in. And so that's why, particularly either dead teeth that have been or have not been treated with a root canal harbor bad bacteria, pathogens. Bacteria, dental infections are notoriously mixed bacteria and fungus. And so ozone is a great adjunct to disinfect that area, and it can help people keep root canal teeth. Now, there's a lot of fear about root canals, and rightly so. Before the use of ozone in that area where a tooth has a root canal, there's a great correlation, very strong correlation between root canal teeth and cancer on that side of the body. That's not to say that root canal teeth cause cancer, but they are correlated. So I've done research, and there was a dentist in North Carolina who, some couple of decades ago, did some research that 97% of the patients that he studied who had cancer had root canals. So the general rule about root canals and cancer is if you have cancer, you should get your root canal teeth out, but you wait on changing out the mercury amalgam fillings. So if you have an active diagnosis of cancer, the recommendation is to get the root canal teeth out, but you wait on the mercury fillings until you're not in an active diagnosis. Um, then the other caveat there is if you've had bisphosphonate medications for osteoporosis, you have to be very careful doing oral surgery. Those bisphosphonates for osteoporosis have a 40-year half-life, and the most important side effect of those medicines is osteonecrosis of the jaw, which is something that ozone can treat, but there's not a great treatment for osteonecrosis. So those are some nuances of ozone that you have to be very careful when you are talking about doing any kind of oral surgery. If you've had those bisphosphonates, the ozone is the only treatment that I know for the best treatment that I know for any kind of oral cancer or even the osteonecrosis. If you wind up with a lesion, then ozone is the way that I know to treat that also. So that's a kind of a recap of root canals, when to get them out, some alternative treatment, the new regenerative root canal treatment, and a good bit about ozone. So ozone is made in our office. We use an oxygen tank, and I have a medical ozone generator, which basically has a lightning bolt mechanism inside, because the way nature does it is that when lightning strikes, then that will slam oxygen molecules together, and then O2 becomes O3, O4, O5, all the way to O21. But they like to be O2. So then the extra oxygen will come off. And if you split an oxygen, which is O2, into two singlets, oxygen singlets, then that's an O-1 and a -1. And those ions basically are what ozone is. It's that negative ion donor, electron donor, that is so healing to the body. So anything that gives you electron, an electron donor, and we'll do another talk um, about gum disease and gum recession and tartar in your mouth. And that relates to this in a way that if you don't have enough buffering system in your body, then you'll hijack your calcium out of your mouth. So that'll be the next one I'll do.